Good evening. This is Dr. Thomas Klein coming to you from Raleigh, North Carolina. Our focus of this Monday series is people with rare painful diseases and not being treated. If a doctor has a treatment available and it's legal and it's not contraindicated, which is our word for means you can't do it. For example, if you have a penicillin allergy, penicillin is contraindicated for treating sore throats. If it's not contraindicated, then you really must use the medicine. If a person has type 1 diabetes, there's only one medicine, and that's insulin. You got to give it. For pain, the FDA has only approved one drug for severe pain, which all 10 million people who have rare painful diseases have severe pain. Then you got to use it. You can't not use it because you're afraid of the government. I saw a story the other day about a physician in the death camps in Germany during World War II who faked and got around the instructions to torture people. And he was the only person not charged at the Nuremberg trials. Physicians have stuck to their 2,500-year-old tradition, and part of that tradition is you treat the patient first, and if there are problems with the government, you deal with the government, but you don't throw your patients under the bus. Anyway, so this is part 2 of our Twitter surveys. And by the way, some people have been asking about this little train car and this little bird. These are props from my 11-year-old producer and camera operator, and he just thought that maybe it would just look a little better than some boring doctor's office, so we're going to keep them there. Here's a survey. How many consented to being taken off their pain medicines? 5%. Only 1 in 20 have actually consented to do this. This is forced. This is being forced to give up your pain medicine and rupture the doctor-patient relationship at the urging of the federal government through the CDC. They claim they didn't tell the doctors to do this, that all the doctors in the United States, 1 million of them, misinterpreted the CDC guidelines. Do you know what that is? That's called gaslighting. In other words, gee, all the doctors in the country are idiots because they couldn't understand our CDC guidelines. Gaslighting. So what they did is frighten doctors and taken people off without consenting, which is gross ethical misconduct, and it is gross medical negligence. Okay, so the next question was, how many are forced to go to pain clinics, and the doctors there, what did they do? They increased the dose of the older medicine, that was good, in 1 out of 5. They started a new pain medicine, 1 out of 5. 60%, they refused to do either. So you go to a pain clinic and you're on long-term pain medicine for your painful disease as the only treatment available to suppress these god-awful symptoms. And the pain clinic refuses to continue with the treatment. We had a survey a while back that a third of the patients going to clinics were told if they didn't get a $1,000 spinal injection with steroids, they wouldn't be given a prescription. A third of the clinics refused prescriptions, and a third were very supportive of the patients. How many of you have had operations, surgery, and were denied the use of pain medicine after the operation? 2/3. How many of you are having problems getting pain medicines from your dentist after painful procedures? 90%. I talked to my dentist. He said when you go to these continuing medical education, they're being told as dentists that Tylenol works just as good as opiate pain medicine. That's not true. I'm not talking to my dentist. And since we have no evidence that people who have had a previous opiate pain medicine can addict to the pain medicine, all the dentists have to do is say, have you ever had a pain medicine? And if somebody says yes, and you say, were you addicted to it? No. Then you can safely give the medicine. It will not cause addiction. How many people are having trouble getting pain relief for their pets? 2/3. So you see the CDC, DEA, prop evilness, it's evil, has now got to veterinarians because they're afraid that if you get a medicine for your dog, you're going to go home and sell it and become an addict. That's pretty bad. By the way, the whole business of cutting down on opiates to prevent addiction and overdose deaths, this was already tried. In 1924, the federal government interfered with the practice of medicine and told doctors they couldn't use diamorphine anymore for pain relief. Diamorphine is an opiate painkiller, and it is about like oxycodone, but it's actually better. It's used in the United Kingdom for babies and small children because it doesn't have a real bitter taste. It's used for labor and delivery. The trade name, all drugs have a generic name and a trade name. So the generic name for this drug is diamorphine. The trade name given to it by Bayer when it was invented back in 1895 is heroin. Now, we wanted to know when people were denied their pain medicine. Were they denied before the CDC guideline in March 2016, or were they denied after? And the answer was 17% were denied their pain medicines before 2016, and 75% were denied after the publication of the CDC guidelines for opioid treatment in chronic pain. Not treatment of chronic pain, treatment of opioids. You see what their agenda is? So it's clearly related. Excuse me. Little hay fever there. It's clearly related to the CDC guidelines, and as we've said before, in spite of the fact obviously they're running around denying everything, even though they did finally say they're causing harm. So they said they're causing harm, and then they didn't retract them. They just revised them, and they're just as bad as they were before. So the best way to tell, and we've said this before, is you remove the CDC guidelines from your mind and pretend like they never occurred. Would all of this be happening? Would 7 million people in the United States with rare painful diseases be taken off their medicine? Next is, we got one more here. How many of you have been prescribed a benzodiazepine along with your opiate, and was it helpful? there's this thing where people are being given a choice between their opiate and the benzodiazepines for no rational reason. Yes, the FDA has said be careful when you're using these two together. Being careful is different than not using it at all. And by the way, the FDA has 600 black boxes, and this is one of them. 96%, which surprised us, have said the combination of the two worked better than either one alone. So that's the end of our Monday night football, Monday night talk on pain medicine and how the CDC has driven a wedge between patients and doctors and done so without proper authorization. Good night.